A lot of docs will say, well, you don't have the money. I'm telling you, I've seen patients within a 2 to 3 month period easily pay $100 for shockwave and $55 for chiropractic.
Say like, listen, what I've seen and had enough clients tell me that if they're worried about running out of benefits for chiropractic care, but you're showing them some healing with their goals and they're getting better and they can start working towards doing the things that they're not able to do when they first come, they will use discretionary money to get better.
Uh,
So they may use up all their healthcare, but they'll continue to pay for their improvements for you helping them.
Yeah, this will probably rub some docs the wrong way, but that's okay. Is if they're questioning if the patient will be able to afford it, they themselves probably have a little bit of a money issue or a spending money on healthcare issue. Is would you spend it yourself if you had to? It's the first question I ask my clients, right? So is your own mindset getting in the way of taking care of people, right? So I've seen some offices that will charge $150, $200 a visit across North America, and patients don't even blink. And I've seen some offices keep their fees at $35 a treatment, $40 or $50, and do 15 minutes of soft tissue and everything. And the patients leave after 5 visits because they can't afford it. Now that's just ridiculous because someone over here is spending $200, someone over here is spending 40. So it's a lot of it is mindset for sure, 100%. I know personally in our facility, we never really think about money. Obviously, if a patient has hesitation, we want to talk about it, but we act as if anyone can, anyone and everyone can afford it. And now 50% of the time they're spending between 90 and $155.
I also know that if I don't have any benefits, a self-employed guy, and I may not want to spend money on massage or corrective care. If I'm having trouble doing my life, I can't raise my arm or I can't sleep at night, and I'm getting better, I will pay for that. I will spend the money on fixing myself, and it might have to come out of other discretionary
Yeah,
funds.
all I know is it's helps patients at a higher level. It gives them options. They can do both at the same time. And I had a pretty highly successful practice edge, and our billings have been up 20 to 25% since moving to this model.
Remind me again, how many on average per week is your clinic seeing?
We're seeing between 550 and 650, 700 per week.
That's awesome. One of the great benefits of using a device is you don't even have to be in the clinic. You served patients while you and Dr. Carla were on vacation. Yeah.
Our modality, I would call it laser shockwave alternative modality department, probably saw 100 visits each week in those 2 weeks. In the summer, when it's a little bit lower, we're not having a lot of sporting activity. We usually are a little higher than that, but imagine we're collecting, I don't know, between 7 grand each week. So those 2 weeks, $15,000 while we're sitting on vacation because of that model.